Dr. Usman Singh, and we have Julie Logan here. And I'm glad you guys could join us for our second chai chat, our official chai chat today. We're going to be talking about mold, mycotoxins, and SIRS. And we're going to spend about 15 minutes with Julie, who has a lot of experience with this area and a lot of great knowledge that I wanted her to share with you guys about this. And then we're going to open up for question and answer for 15 minutes. So I just wanted to remind you that Chai Chat is sponsored by True Health Naturals. And both of us work at True Health Medical Center in Naperville, Illinois. And I also own a compounding pharmacy called True Compounding Pharmacy. So I know that's a lot, but I just wanted you guys to know about that. I also want you to know that we're here for education. We're not here to give you guys medical advice. Any of the kinds of areas and treatments that we're talking about, you need to discuss with your healthcare practitioner before, undergoing some of the various testing and things that we're going to talk about today. So let's get started. So Julie, thank you so much for being here. We have our chai in hand, so I hope you guys have some. Today we are drinking matcha in the Japanese bowls, and we have it all ready to go. So hope you guys get some nice tea. The matcha we're picking today is a green tea. It's high in antioxidants, and these types of antioxidants help our liver, which you're going to tell us about. And they also help to detoxify some mycotoxins, which you're going to tell us about. So let's get started. So maybe you can kind of start with telling us what in the heck is SIRS?
So SIRS stands for Chronic Inflammatory Response Syndrome, and that designates an illness that's created by an exposure to a biotoxin. So biotoxins are poisons and toxins that come from living organisms. So the most common producers that we're exposed to in our environment come from molds and mycotoxins, but they can also come from Lyme. That's number 2. And then there are a few other things that can also qualify, like the bite of a brown recluse spider and some fish-borne illnesses as well. But the biggest things that we're exposed to in our patient population are going to be number 1, mold, and number 2, Lyme.
So when we're talking about biotoxins, these are different than other toxins that we talk a lot about, like heavy metals and chemicals. And so why are these so special?
Well, they're special in that they're bad for everybody, but about 22% of people in the human population cannot actually clear them out of their body, and that is identifiable by the person's genetics. So there's a grouping of genetics called HLA genes, or human leukocyte antigen genes. These sit on chromosome number 6, and they code for the types of immune responses that we can have. So in this susceptible population, they cannot actually make antibodies that will clear these types of toxins out. And so they will get sick and they will stay sick.
Well, what are the symptoms of people who have this type of response to these biotoxins?
So we're going to try to share a biotoxin symptom cluster. So if we click over here on share here and then preview, you're going to have to let us know if you can see this. It should look like something, and if it looks like nothing, then that's okay. Basically, we're looking at a lot of neurologic inflammation, so strange neurologic symptoms. So I'm going to talk about adults first. So brain fog, chronic fatigue, trouble finding words, trouble making your brain last through the day. So fatigue starts to shut people down, and that's because there's actual neurologic damage going on. These mycotoxins actually have an affinity for nerve and brain tissue, so they bind to our nerves, both in the central nervous system and in the periphery, causing a lot of symptoms that way. So another big symptom cluster has to do with immune suppression. So people are going to have symptoms of getting colds and other illnesses frequently, more frequently than they used to, or more frequently than other people in the same environment. Allergy type symptoms can also occur. Now, I want to designate this is not a mold allergy. People can have allergies to molds. People can also have overgrowth of candida and other yeasts and fungi in the digestive tract. These are independent situations. So someone could have all of these going on at the same time, but they are not the same thing. So chronic joint pain, the symptoms of Lyme illness and the symptoms of mold illness look identical. In fact, you can't tell what your exposure was from the symptom alone. Another big area where people have symptoms is in the gut. So gut inflammation happens because, again, the barrier function of the immune system is compromised. So every barrier, the mucosal barrier, the gut barrier, the blood-brain barrier, are compromised by the inflammation that's triggered by these mycotoxins.
So these symptoms are common symptoms that a lot of us might have, but it's just how they cluster together that makes them more serious.
So in a normal immune response, the innate immune system responds first. So you get infected with something, you get exposed to something, your innate immune system will respond. That's going to release a lot of inflammation. It's going to be pain, fatigue, fever even. What's supposed to happen then is there's supposed to be a bridge to the adaptive immune system, which makes antibodies that are specific for that infection or that toxin to clear it out. In the 22% of people who are genetically susceptible, that handoff never happens. And so they stay stuck with this constant output of inflammatory mediators that doesn't go away because they can never clear the toxins out.
What would you think would be symptoms that you might see in a child with autism?
So if a large percentage of our patients are children with autism or other neurodevelopmental disorders, so the things that make me suspect that there's a mold exposure are a child who is sick all the time, a child who has a lot of allergies, a child who seems to have immune compromise, but we can't really figure out exactly what it is. It doesn't fit some of the classic pictures. And then, of course, a history of exposure. Another big key for me is if the child is showing symptoms of PANDAS. So PANDAS is severe neurologic inflammation that's triggered by strep and some other infections, including Lyme. But what we're starting to suspect is that the kind of inflammation triggered by mycotoxins in a susceptible person could also be looking like a PANDAS or PANS type of scenario.
So like these inflammatory reactions that we sometimes see in our children with autism, we sometimes see in our patients with PANS and PANDAS, we sometimes see in our patients with mast cell activation syndrome. And so it gets a little blurry as to what's going on. How do you kind of like sift it all out? Like you mentioned history. What would you necessarily see in a history that would kind of point us in this direction of SIRS?
So water damage building. So the statistics are that over 50% of all buildings in the United States have sustained water damage and could be at risk for developing mold. So you have to understand that the mold spores are in any organic material. So if it's made from wood, the spores are already in it. All it takes is a little water and they come to life and they become very happy. So they start multiplying and creating a life cycle. And as a result of that, they release airborne toxins into your environment. These are inhaled and the person becomes ill in different ways. So the history of water damage is suspicious. And I ask every patient who comes in whether or not there's been water damage. A lot of times you can't see, you don't know what's going on inside the walls or in the crawl space or in the attic and other places. And so there are ways to test both a household or an environment as well as the individual.
Okay, so maybe we can talk a little bit about how do you evaluate, like what type of testing can be done to look at this?
Yeah,
a little bit more deeper.
So the testing for the home is called ERMI testing. That's ERMI, and it's actually a swab test. So the dust is collected in the house and then that's evaluated. So an ERMI score above 2 is a biohazard for people who are in this genetically susceptible population. So that's one way. There is another way to test your house. It's called HERTSMI, which is looking at a slightly less diverse number of toxins than the ERMI test is doing. But there are also ways to test a person. So number one, we're going to look at their HLA genotype. This is a test we can get from LabCorp. It goes through a person's normal insurance policy. We will look for that. If they're in a susceptible population, we know that they're going to be at greater risk for developing an inflammatory response to the things in their environment. From there, we can also look for these inflammatory mediators. So there are some great doctors out there. Dr. Shoemaker, Dr. Neil Nathan, who have done a lot of work in putting together an understanding of what these inflammatory mediators are and then what they're doing in the body. So examples would be C4A, TGF beta 1, MMP9, and then there are some others that have to do with the misfunctions that are happening in the body as a downstream effect of all of these other inflammatory mediators being high. So additionally, in an adult or a person old enough to cooperate, we have a test called the visual contrast sensitivity test. And this actually is able to test the optic nerve's ability to distinguish contrast, which is not the same thing as, what is your vision 20/20. So we can have 20/20 vision and not be able to distinguish contrast. And so when the optic nerve, which is a great big nerve in the brain, is inflamed by mycotoxins being attached to it, then we will lose that contrast. And so this is an easy test to run. It's online. Person goes to the site. It takes a few minutes to fill out your paperwork. And then you take it. It takes about 15 minutes. And you will get a pass-fail. If a person fails and they have a history of exposure and they have symptoms, it's a 98% sensitivity and specificity to a SIRS scenario.
And is there a certain website, or they can just Google visual contrast sensitivity?
You could get to it that way. The survivingmold.com website has a link to it. It usually costs a small amount. I think it's about $15 for a test. And again, you'll get a report. And this is something that we use to establish a baseline as part of the diagnostic criteria in people who are old enough to cooperate with it. But you can also use it to figure out to basically gauge your progress when you are in the process of treating. So it helps you know when you're ready to move from one step to the next step.
Okay, excellent. So you do, you get the good history, you do some testing, you do the HLA testing, you do some blood testing, the visual contrast sensitivity testing, and you come up with your kind of diagnosis. Then what? Like, what are the steps in terms of like treatment? Is there dietary recommendations? Are there nutrients? Are there certain protocols that we're going to follow for these folks?
Absolutely. So, and this is absolutely critical. So we're going to focus more on mold because mycotoxin exposure is much more common even than Lyme. So in terms of dietary interventions, most of the children who are coming to see us are either starting or are going to be put on a gluten-free, casein-free diet. Additionally, in people who are suffering from mold-related illness, we want them to avoid foods that have mold inherently or foods that are fermented, mushrooms, cheese, things that are known to be mold contaminated. So peanuts, Brazil nuts, certain grains, foods that have sat around for a long time and maybe more at risk of having mold, whether you can see it or not. So we're going to basically want people to follow an anti-inflammatory diet. But the key step, number one, is you have to get out of the exposure. So if you're in a building or a house that has tested greater than 2 on the ERMI test, you have to remediate it or you have to get out of it. You cannot get better if you are not out of the exposure. So that's number one. That's the foundation of everything. Number two is then for mycotoxins, we're going to initiate a binder therapy. So there are some substances that are able to bind those mycotoxins. The way that they do it is they actually bind bile. And because mycotoxins love fatty tissue, they will also be bound up in the bile. Now, normally the body uses it to digest and then reabsorbs it. This process is called enterohepatic recirculation. But the bile is loaded with these toxins. And so we can use certain binders like cholestyramine or Welchol or even activated charcoal to bind the bile, which then takes out a load of mycotoxins every time we administer it. So binder therapy is essential because remember, in this susceptible population, they cannot clear the toxins themselves. So the way that we know we're done with the binder portion of the therapy is when the person passes their visual contrast test again.
Okay. So besides binders, do you use other things to kind of support this whole, the bile, the liver,
Absolutely.
the gut?
Absolutely. So along with the core, which is the binding, protocol, we would use substances that support liver detoxification, which we talked about a lot on our first talk. Things like glutathione, N-acetylcysteine. There are herbal formulas that combine liver support ingredients. So we would rely on those. Another very important piece is we do lipid therapy. So that's healthy fats, that's phosphatidylcholine, that's going to be fish oil. And then there's a substance or a class of substances called resolvins that are found in fish oil and some of the omega oils, but that are the really anti-inflammatory parts of that are concentrated down. And those are called resolvins. And there are a number of companies that make products like that. Additionally, other healthy oils like a balance oil that has omegas in a certain ratio to each other is going to be implemented. That supports the liver and it supports bile production, but it also helps repair the damaged cell membranes. And remember that we said that these mycotoxins have an affinity for nerve tissue, brain tissue, neurons. So the neurons need to be repaired. So this is an important part of the first step of this process.
So in the scheme of things, when we, see people and we start different protocols, where does this kind of fit in the whole process? Do you do this type of therapy with the binders first and then do some of your other protocols and the other types of detoxification that we do? Or, because I feel like we're learning about this now, where I kind of feel like this should be like our first step.
If we know a person is in a biotoxic exposure, especially mycotoxins, it becomes number one. And it depends on the ability of the family to carry out these steps. Some people will be overwhelmed and some people can handle doing 12 or 15 things at the same time. So we have to customize it according to what people can manage, but dealing with this would come early on. Most of the time when we see a child for the first time, we're going to be looking for infections. We're going to be looking for exposures. We're going to create a list and an agenda of things that need to be dealt with and then prioritize what needs to be done first. Changing the diet, using healthy fats. These things come very early on. It doesn't matter which child we're treating.
Right. Supporting the liver.
Right.
Yeah. Working on detox. Working on those, the things that we talked about last week, the pathways of elimination, the liver, the kidney, the lymph. It's really important for these types of patients too. Right?
And also we talked about constipation. With binder therapy, you've got to be able to get this stuff out. So that has to be established. So some of the reasons why we might not be able to start right away is if depending on the fragility of a patient, if a patient is extremely fragile, if they're very constipated, not having bowel movements except kind of by force, like by enema, that will have to resolve those things before we would move into binder therapy.
Okay, great. Any last bits of info you want to share with us?
I want to, say that there's a lot of hope with this. I'm excited to see the correlations when we're testing some of our children who may have a PANS-PANDA sort of presentation, and we see that they actually have these genes, because I'm not excited that they're suffering, but I'm excited because there's a solution for these problems. So people have suffered for years sometimes without getting any help, sick with something that looks like Lyme. Maybe it is Lyme, maybe it's Lyme and mold, and no one knows how to help them. They've been to doctor after doctor. They're told they're crazy. It's all in their head. You're depressed. You're on, sleep aids and antidepressants, but there's a solution for this. And so it's exciting to me to have the tools in our hands to help people with their really serious systemic illnesses.
Great. That sounds really promising. I'm happy to hear about this and learn more from you. So thank you so much for all of this. So I'm going to open it up for questions from you guys. If you have any further questions, we're happy to answer your questions. Just post them on our on Facebook and we can get to them. It says, can you link what you are reading? I don't know what I think you were mentioning the symptoms of biotoxin illness. Is there a website that they can go to? You mentioned a couple.
Survivingmold.com is a great place. That website is Dr. Richie Shoemaker. It's his website, and it has a lot of great information, including all the steps that I talked about. It's not going to mention PANS and PANDAS. That's the connection that we're making clinically, and some other doctors as well. But it will give you the same information that I'm referring to.
And so here's a question. How long generally is treatment?
So again, it depends on the person. Normally, if we can get a person out of the exposure and start binder therapy, that phase is 1 to 2 months. There are some other steps that have to be addressed. One of those is that people who are in a mold exposure very often have a colonization of a certain type of bacteria up in the nasal passages called Marcons. We have to test for that. That's the next step after binder therapy. So when a person gets through their binder therapy step, we retest the visual contrast sensitivity, and then we go to treating the Marcons, and that's another about a 6-week process.
And can you tell our listeners what Marcon stands for?
It's multiple antibiotic resistant coagulase negative
Staphylococcus
aureus. It's a long name. Again, this is not an infection. It's a colonization and a biofilm. And these critters release neurotoxins directly into the brain, and they also further impede the regulation of the inflammatory response. So I want to go back really quick because I didn't answer how long. It definitely varies, but you're looking at months. But in a person who is able to get through the steps quickly, there is resolution at the end of that. So we're not talking about years.
Okay. And then how long would somebody have to be on the cholestyramine? That's the 6 to 8 week.
That's right. And so it's determined by when you pass your visual contrast sensitivity test. That's what tells us that we're ready to move to the next step. If you don't pass it, then there's a chance you're still in the exposure. Or there's also a chance, so for example, if it's not mold and it's Lyme, or let's say it's both, we have to treat the Lyme as well. And so if your SIRS is Lyme and not mold, then the binder part is actually more about treating the infection.
Right. So what percentage of PANS kids do you think have a mold component? And how often is it the prime cause of PANS?
So I think, well, we don't know because we're in the newer stages of exploring this connection, but I'm seeing it a lot. I'm seeing it, I will say, the majority of the time, where when I start asking these questions, the parents are going, yes, actually, the child was born and we were in a moldy basement, or there is a connection there. So I'm seeing it a lot. I wouldn't say it's necessarily the prime, but it sets the stage for this neuroinflammation to kick into high gear when then there is that strep or mycoplasma or Lyme on top of that. So right now it's too early for us to be able to say that mold exposure alone creates the PANDAS scenario, but it certainly gets them a whole lot closer to threshold, and then they get over that threshold. And the infection is another, again, a biotoxic exposure kicks things into high gear.
Okay. Here's another one. Are there any herbs that you might want to consider for mold treatment?
So herbs can be very helpful and strongly anti-inflammatory. So the Buhner herbs like Japanese knotweed, Chinese skullcap, kudzu, red sage, and probably a bunch of others, he has studied those to show how they dismantle parts of this inflammatory cascade. So when curcumin is another one, boswellia. So, green tea, and then high doses of fish oil, high doses of EPA and DHA are all things that, well, no, that's not an herb, but those are all things that help dismantle the inflammatory cascade, but in different ways. So at different points along it. So all of them can be used together to help with this.
Yeah. And then herbs for the liver, supporting the liver.
Milk thistle and some of the others. Yeah.
All right, great. And I think, let's see, a few more questions. Does mold permanently damage your brain?
So that's a good question. I think the answer could be yes for some people, and hopefully no for a lot more people. It depends on how long you've been in the exposure and what else is going on. There's an interesting technology that I'm hearing about. We don't ourselves have access to it, but it's called NeuroQuant. And it's basically a program that's run from a brain MRI, and it's able to look at the volumetric measurements of the brain. And there are signature changes if you have Lyme, if you have mold exposure. They're not the same as each other. So the NeuroQuant is actually able to distinguish between these causes. And so there's a difference between atrophy and dendritic pruning. So atrophy tends to be permanent loss, and dendritic pruning, which is basically where the connections between the nerves get pruned back in an inflammatory situation, those can regrow. So that's the research that I'm studying right now. And how do we know? Well, we don't know until we remove the exposure, remove the biotoxins, bring the inflammation down, and then we're able to see what is restored and what isn't restored.
So the NeuroQuant is a portion of the MRI. So you do a brain MRI and you order a NeuroQuant on top of that.
Yeah.
And then the NeuroQuant is this quantitative measure of what's happening in that limbic system that's so affected by the mycotoxins and Lyme and PANS. So that's the area that we're really concerned about. So that type of testing can be really valuable. How do you spell NeuroQuant? NeuroQuant.
Yeah, you got it.
Thank you, Olga.
That's
All
right.
right. And so here's another one. If Lyme and PANS is a factor for a child, where does direction of treatment go if you are out of a suspected mold environment and there's no Lyme flaring currently? Is it just about immune modulating them?
So apparently we can determine whether there's an active bacterial presence with using a marker called C3A. So it's part of the complement immune system, and C3A will be elevated if there is active bacterial cell presence. So if we have a person who has both mold exposure and, like you said, they're out of the exposure, so we're just trying to decide, are we going to do binder therapy? Are we going to treat with antibiotics or antimicrobial herbals? We can look at the C4A and C3A to help us make a determination what is the biggest situation for this person right now. So
C4A, you're thinking there's something active, there's still an active
mold.
Something.
C4A rises very quickly in response to a mold exposure.
Is it just mold with C4A, or can an infection trigger it?
Primarily, it's going to be mold, and there are like a sliding scale where if it's between this number and that number, you think this, and if it gets over a certain number and C3A is high, then it could be Lyme alone, and that's where the other testing helps us to be able to distinguish. So the ERMI testing and some other things would help us know, because people do sometimes have both going on, unfortunately.
Right. So this is really great information. Thank you so much, Julie. What do you do for someone who's constipated? We did talk about it last week, but it's really important that these toxins leave the body. If we're trying to detox and they stay inside and we're constipated, then we have that enterohepatic circulation and everything gets reabsorbed. So the biggies for constipation, vitamin C, different types of magnesium oxide, magnesium citrate. There are different types of herbs that help with motility, like Cascara sagrada, senna. I really like Triphala, which is an Ayurvedic herb that's very nice too. A lot of our patients do well with things like the oxygenated magnesium type products. And aloe juice is really nice, prune juice. Sometimes kids do well with fibers and some prebiotics as well for constipation. So make sure that the patients are going on a regular basis whenever you're doing these types of detox protocols. One more last question, or what is a high C4A? I know you kind of hit it, but what does C4A stand for?
It's complement 4A. It's a fraction of a complement 4. And it is particularly significant when it comes to mold exposure. So it's a test that can be ordered primarily through National Jewish Labs. So it's a little bit of a trick sometimes to get that specific one. But it is a great guide for whether or not a person's in a mold exposure. So I do see a question. It says, do you take moms as patients? We take moms, we take dads, we take everybody, because SIRS is not really designated as a childhood illness. As I said, we're making the connection from what we see in our clinical practice that there is in fact a SIRS type component in our PANS, PANDAS kids and some of our other kids. So yes, we are taking parents as patients as well.
And do you have appointments available?
I do.
Great, great. So yes, at True Health Medical Center, we have Julie Logan, and we have a new practitioner, Margaret, which none of us can actually pronounce her last name, but we'll have Margaret come and chat with you guys at some point in time, but she's a nurse practitioner. She just started as well. And I have some openings as well lately. I opened up my schedule in the next couple of weeks. So we are all available to you guys for your needs. And I just want to, again, thank our sponsor, True Health Naturals. And thank you guys all for joining us with our tea today. Take a couple of sips, take a couple of deep breaths, read a little bit about SIRS, read a little bit about mold on your free time, and enjoy the rest of your day. Thank you very much. You did great. You're so impressive. You are.
You guys are still talking.
You were like rolling on that immune stuff. I was like, oh my God. You did such a good job explaining all that. Very
Perfect.
nice.
Thank you.
You're so impressive.
Oh shit. You guys are still
It says
talking.
stop streaming.
Rolling on that.
It says stop.